Hi, my name is Lindsay Kusy. I'm a licensed mental health counselor, a certified clinical trauma professional, a certified compassion fatigue professional, and a certified advanced grief counseling specialist with a focus in child and adolescence. I'm also a QPR gatekeeper instructor, and I'm the education behavioral health coordinator and rendering provider here at Cummins Behavioral Health Systems. We're so glad that you joined us today to hear a little bit more about trauma and trauma-informed care. This is going to be a brief conversation, as this could be a very long topic, but we want to just give you an introduction to what trauma and trauma-informed care looks like. So that's what we're going to talk about today. We're going to define both of these. The one thing that we want to start with is that everybody, their biology, their nervous system, all is driven by our need to survive and our need for connection. And trauma disrupts this. We are hardwired for these. Connection allows attachment and safety, adaptability, emotion regulation, resiliency, a whole host of space that we want our kids to be able to thrive in. And when these are interrupted or disrupted by trauma, it creates those behavioral drives to either survive in the moment or connect in that moment. One thing to really be mindful of when we talk about safety is that we can be safe. Physically, our bodies can be safe in that moment, but it might not feel safe. It might be a space that reminds them of something, or it just might be that their nervous systems can't calm down in those moments. So let's talk about trauma. First, we have single trauma events. Those are the things that we think about when somebody says PTSD or a car accident. It's those single, repeated, at unpredictable intervals that are real or perceived threats to life, safety, and physical integrity. What we see most of with our students and with families that we work with, especially at Cummins, is that complex trauma. Either it's generational or it's something that our child has experienced or maybe we experienced. And it's those environments that train reactions and responses that become characteristics and traits of who we are. And that really is a change in how we respond to people or how we move forward in the world, all out of that drive to survive and drive to connect. So what is trauma? It's a painful or threatening experience that happens. And when that happens, our amygdala, which is our smoke detector in the brain, charges and codes that memory. And so in similar situations, we might perceive a threat. And perceive is a really important word. So like the picture, this woman may have been a dog lover. She was bit by a dog. And now this is what she sees, right? We might be walking next to her on the street and think, what is this about? Why is she so upset? And this is what we can learn. She was bit by that dog, so anytime she sees a dog, she perceives it to be a threat. The thing with trauma is it's a sensory experience. It's not logical. So their brains don't always make sense of what's happening in those moments. An event becomes traumatic because it overwhelms our capacity to cope. Again, it's a sensory experience. It's not logical. And so when these are happening to us, it's those perceived situations that set off that smoke detector. Just as if we burn toast in our kitchen, the same thing can happen when we have our amygdala go off. It doesn't necessarily mean there's a threat, but it could be a threat. So what is trauma-informed care? This is really a strength-based approach that many places try to work from. It's evidence-based treatment. We look at that appreciation for the high prevalence of traumatic experiences and understand that there's a profound shift in that individual who's experienced it. It's a strengths-based approach to working with individuals. And if we walk through the world in a way that just allows us to recognize and realize that there's widespread impacts of trauma and that we can just assume that anybody we come in contact with is experiencing the world in a trauma through a trauma lens. And when we can experience the world with them through a trauma-informed lens, we can have a kinder, compassionate way to work with them. So the first step is to realize. And there's a quick video. So how do we help work through some of this? And we can work through this through resilience. Resilience is not a trait that people have or do not have. It involves behaviors, thoughts, and actions that can be learned and practiced. It's ways that we can help move through recovery and talk about that resilience in ways that we can help realize what's happening. So there's really 6 pillars of resilience that we talk about. One is the growth mindset. And through this growth mindset, we talk about the not yet. I don't have this yet. I don't understand this yet. It's that space that we're trying to build, the ability to think that I can do this. It's not that I can't do this. Another space with the 6 pillars of resilience is emotional intelligence. And when we have emotional intelligence, we are able to walk through the world to have insight and empathy for others. We have our own emotion regulation, and we're able to use that in connection with others, which leads into community connection. When we have that emotional intelligence and that growth mindset, we build those community connections. We build that village. We build that connective space that we have with other people. When we talk about self-expression, there has to be ways within our resilience that we can express ourselves through music, through art, through journaling. It could just be doing something in a new way. When we talk about embodiment, we're talking about that space where we do have self-care. What are those things that we can do to help our bodies? Is it moving? Is it resting? Is it spiritual? Is it physical? What are we needing in those moments? And last is that choice and control. Where do I have space to have choice and control? I can't control what other people do or act or say. Where do I have choice and control through this? So now that we have worked through realizing that this is an impact, we can move into recognition. And so when we think about how trauma can present, it can present in multiple ways. There's a lot on this slide on purpose because it really shows this non-exclusive list of how our youth or how we can show up with trauma symptoms. What might you see when you have a trauma symptom or a trauma response that happens with a student or a child in your home? One thing might be that they engage in flight. Their nervous system goes into fight, flight, or freeze. And these might be some of the things that you see. Fight, flight, and freeze. This is our amygdala on alert. This is our amygdala saying something's happening, and when this is happening, we are not present. From the Task Force on Children Affected by Domestic Violence, an example from a student was given. I could see the math teacher's mouth moving, but could not hear a thing. It was as if I were in a soundless chamber. I just couldn't process a word of it. Adolescents who have suffered physical or emotional abuse have evidence of brain damage, particularly to their prefrontal cortex, this front part of their brain, that really impacts motivation and impulse control. So how does this look? Think about a time that maybe you burned your hand or you had a sunburn, and what did you do to avoid that pain? How much space were you in that you really just tried to avoid anybody touching you, being around you, any of those situations? If somebody tries to poke you or touch your burn, you usually get mad. And that's similar to what's happening when we have a trauma response. The really important thing to remember is that when we've had developmental trauma, that repeated trauma that we've talked about, they're needing that survival first. Our survival and connection have to feel regulated before we can move into space of learning or listening in a family environment. Childhood trauma really impacts every single part of the child. So we know all of that. What do we do now? We learn to respond. I was doing a training for some young interns working with youth who have experienced a great deal of trauma. And one intern mentioned how hard it was to work with the families sometimes because they've heard the stories that the students have shared. And I brought this up specifically that when we're curious, we're viewing the world that everyone is doing the best that they can. And we need to walk through the world thinking, what's happened? What happened to that family? What happened to that parent? What happened to be in the space that they're in? And if we can respond with a what happened versus a what's wrong with you, it can really shift that labeling language. Let's talk more about that response in that labeling language. If we're not trauma informed, We might not think of people having a trauma history. We might engage in power struggles or focus on that compliance. We think behavior is intentional and purposeful, and we use that labeling language. In a trauma-informed space, we're gonna know, or we're gonna assess, we're gonna know that there's that those traumas happened. We're gonna have minimization of power and control over people and really focus on collaboration. And even with kids, collaboration is something that we can do together. How are we going to work through this? Where do we find that problem? It builds emotional intelligence, having the conversation, and also allows them space because sometimes they're harder on themselves than we could ever be. We understand from an adult perspective that all behavior has meaning, and we're going to use objective or neutral language. Some things that you might not see or hear in a non-trauma informed space is assuming somebody's name, assuming, why are you here? If I have to tell you one more time, not saying hello or goodbye, and having disorganization or overstimulation in a room. Whereas in a trauma-informed space, we're going to ask how a person might prefer to be addressed. How can I help you? Let's find something to do together. Greeting the student or the person that you're working with, or if it's your child, just saying hello and goodbye, especially if you're leaving for the day or coming home, having an organized and neat space. And behaviors we might see out of somebody who's not trauma-informed is that they focus on their own experiences, what's wrong, complaints. They might underestimate influence on others. They might not respect that positivity should be the priority. And in a trauma-informed space, we're going to focus on experience of others, how we can help. We understand there's power in interactions, and we're going to approach the day with a gratitude or a positive mindset. When we build all of this, we can resist re-traumatization. When we know, when we learn, when we see what's going on around us, and we implement these 4 R's of trauma-informed care, it allows us to walk through the world and help others and understand that something may have happened to them. Thank you so much for joining us today as we talked about the introduction to trauma and trauma-informed care. Please reach out to anybody at Cummins if you have questions or if you're interested in seeking services with us.